Welcome to the PGN Podcast.
With this podcast, we're looking to normalise the conversation around flooding, what happens behind the scenes, lifting the curtains, and the mystery that could sometimes come into play when you're either involved with flooding or trying to protect your home or business. We're talking to some experts within the industry and relaying some of the experiences we've heard from some communities around the region.
Hopefully, after our series, you'll have a bit more information to help yourself and others in an emergency where flooding is involved.
We have a diverse network of partners and friends, some of whom could not join us in person. This is a bonus episode where we catch up with some of them virtually.
Hello and welcome back to the PGN Podcast. So today we're going to talk a bit about the damages of flooding you don't particularly see, people-related mental health, and you know how they could be quantified and how they can be represented. So today we're joined by Jed Ramsay again from Buckinghamshire. So hello, Jed.
Hi there, Carl. Hi, Meshi.
Always great to speak to someone else from a different lead local flood authority. And you know what firstly to open up, what's your experience been as from a lead local flood authority, you know, representing that in regards to mental health and flooding in your area?
Yeah, it's a big question. So we had in Buckinghamshire, the last groundwater flood was 2014-15, so it'll be 10 years next year actually. And that was the impetus really for Project Groundwater today. And I think we founded the project, myself and my colleague Karen Fisher, really based on her experience at that time and what she saw, which was, you know, people affected in ways that she didn't really anticipate. And you know, the key difference with groundwater is duration and how long it stayed there, and then the impact that had on people. And as a community, it was just notably a marked difference to other sources of flooding. And I think it's really driven Buckinghamshire in particular as a lead local flood authority since then to try and do something about groundwater flooding, which is why we're so excited to have Project Groundwater now and the chance to really, really make a difference with it.
Yeah. And how do you feel groundwater compared to, say, surface water flooding and then flooding from rivers in the sea? How do you feel that impacts people's psychology or approach to it? Because, you know, I think personally with things like surface water flooding, there was so many times where I go out and see residents and say, I shouldn't flood, I don't live near a river. But, you know, surface water, water flows downhill, but groundwater, it doesn't behave like that. So how do you think that, you know, we could put a perspective on each element and how each varies?
Yeah, that's a really tricky area, isn't it? Because I think one of the things people say to us when we're putting out communications about our projects is, it doesn't affect me. I live on a hill.
Yeah.
You know, because like you say, water runs downhill, and that certainly applies to flooding from rivers. You know, if you're halfway up the hill, you're going to be fine. But there's every chance you can have a spring line halfway up a hill, and that's where your groundwater flooding starts. And you might not know it's there, and it might not appear for like a decade.
Yeah.
So, and then suddenly there's essentially a new river running in a place where you've never seen rivers. And this has happened in several locations in our project area. We've got examples of this where rivers have just started flowing basically from springs that only really appear in very, very high groundwater levels. So getting that understanding of how a catchment behaves and how the geology underneath it affects what happens at the surface, it's quite a complex thing to convey, I think. I mean, I work in the industry and I find it complicated to understand.
Yeah.
So for someone just dipping your toe in the water, so to speak, it's even more tricky, I think, to really get your head around.
Just building on that, though, I mean, we had a separate conversation around our expectations when we talk about the water cycle. And it's part of the action plan revisiting what we consider as a normalized water cycle, the stuff you learn in school, the one where it says it rains, it filters through, and then it makes its way to a river and it goes downhill. Is there a conversation here about going back to basics, going back to that water cycle and re-educating our communities on what the urban, essentially, whether it's an urbanized area or rural area, that water cycle largely is significantly different in this day and age because of the lifestyles we live, because of how we, on a day-to-day basis, how we commute between two places, how we entertain, all these things that make us comfortable as human beings have changed what essentially is what we're taught at school as a normal water cycle. We're talking about mental health, and we appreciate that actually when someone floods, it leaves its stain on you, it leaves its mark, and that could represent significant emotional turmoil. It could represent years of just stress of what happens when the next one comes around. And so we don't want to get in a space where we're talking about flooding and then creating panic. So there's a bit of a conversation there on how we can help in the mental health space, because I think information is becoming more and more available, that it is something that can completely destabilize a home just on an emotional level, but also in the awareness piece, we're trying to educate people more how we don't unintentionally create preempt that kind of situation by essentially scaremongering, for use of another word. What do you think about that, Jed?
Yeah, it's a really big topic, I feel. And so I've got some stats from the last big study that was done on mental health and the impacts following a flood. And if your house is internally flooded, in the 2 years that follow that event, you have a 25% chance of developing PTSD. You're 7 times more likely to suffer from depression, and you're 5 times more likely to suffer from anxiety. Now, that's a huge impact. In my view, we as people working in flood risk, that should be the focus of our work, is trying to reduce that impact. The damage to people's homes is in some ways easily repaired. Okay, you've got to deal with insurance, you might not have insurance, there's the cost, the impact, you might have to move out of your home. I mean, this is all difficult stuff and hard to deal with. But compared to mental health, I think those are actually easier. These are physical things that can be resolved with enough resource and support. Whereas how do you reduce the impact on people's mental health is a much more difficult question.
And I think to build on that, to sort of describe an experience that I had, and this isn't a singular experience, it's happened many times, but I'd have people ring me and go, there's really bad rain forecast this afternoon, will my house flood? Do I need to leave work now to prepare? And again, that's the anxiety. And there's been other people as well where I'd speak to them and well, look, we haven't been on holiday for 2 years because we don't want to leave our home. And I think as part of that, as LLFAs, as local authorities, as risk management authorities, there's an expectation that we need to resolve this problem of nature. But obviously there's things like property flood resilience, and there's things like capital schemes through flood defence grant and aid. But they take time. Getting the right solutions take time. So how do we fill that gap? How do we give residents or businesses assurance or support without being at a point where we can deliver a solution?
Yeah, and that's the big question. And even in the places where there are solutions, you're never going to remove flood risk.
No.
I mean, we've seen this in places that flooded recently where defences have been overtopped.
Yeah.
That were built not that long ago, less than 20 years ago, and the defences are already being overwhelmed. So you've got to consider how you anticipate flooding is going to happen, isn't it? It's going to happen across the country, and it's going to be something we have to live with rather than something we try and prevent. I think you can try and reduce it, and that's certainly what we do, isn't it? But it's always going to remain. And I think the question, Carl, of how we help and how people can help themselves there isn't an answer for that at the moment, in my view. And we're looking to commission a big piece of research, hopefully led by a partnership of academic institutions with support from other organisations, and for it to be a long-term study to really look at that question, what is the scale of the problem and what can be done about it? And then what is the best use of resources to have the most positive effect with what we can do? And that, because at the moment, I think we can come up with ideas and try things, which we all are doing on our different respective projects, aren't we? But there isn't a definitive set of answers for this, like maybe there is for the rest of flood risk. If you want to build a scheme, it's fairly straightforward how you go about designing, assessing, doing all of that.
And of course, the solution comes down to a business case, an economic appraisal, making sure that what you spend on a solution costs less than the damage avoided. And
I'm a bit more radical though.
Yeah.
Like I said, I think part of the challenge is, and I'm not having a go at the system, but the current systems we have are geared towards capital investment, things that you can measure and quantify.
Yeah.
And when we talk about mental health, even when we talk about nature or enhancing nature, that becomes a challenge.
Yeah.
Because
and it's tangible against intangible as well. And how do you quantify that on an economic appraisal? So
change the economic appraisal. I think that's the thing. Just put something completely new that's fit for what we need it to be. Because unless we do that, unless we create a space where you can quantify this on its own merits, essentially, that's what I'm saying here, it's always going to be trying to shoehorn it into something else, which is where it becomes limiting and sometimes frustrating. I think the other thing to add to your comment there, Jed, about communities, vulnerable communities, particularly in terms of flood and the kind of mental burden that usually comes with that, and very stark stats you just shared earlier, is I think there's something else that we're picking up, that actually the most vulnerable communities are also the ones that are most likely to suffer repeatedly for flooding. So they don't even have the option to choose between PFR and another.
Yeah.
Their choices are a lot more sometimes fundamental than that. And it's looking at exactly a system that can be holistic, that's not relying on somebody to help yourself without having to put your hand in your pocket. I think ultimately we come back to you have to pay for these things. How can we create a system where there's an action plan, there's a recovery plan? You're not panicking about going home because you have a response system in place that allows you to, if you do flood, you can recover quicker, for example. Like you said, Jeff, living with floods.
Yeah, and again, that's something rainfall is going to get more intense as we move forward. And I'm talking predominantly about surface water, river flooding, but obviously where that water falls can impact groundwater as well. So that affects all sources of flooding. Mm-hmm. But, these events are going to get more extreme and more frequent. And, we as a nation need to be more resilient.
Yeah, we need more intelligent systems, but we also need to be able to open up forms of assessing what the impact of flooding is.
Yeah. So I think at the minute, if you look at the multicolour manual, which is the document that people like myself or Jed would use to do an economic appraisal on an event, there is a cost of, it's around about £2,000 per person who hasn't been impacted by internal flooding. Do you think that is a suitable value on that? Because personally, I feel it should be much higher.
Yeah, I mean, what you're describing there, how you economically appraise a scheme, or what trying to justify, you're essentially talking about justifying the expenditure of public money, and you've got to make sure you're getting the best value for money in the decisions you make with how you spend it. So the figure itself is kind of, in my view, a little misleading, and if you need to actually look at how it's broken down. So that of that 2,000, most of it is the tangible costs, damages you talked about. So, the cost of repairing a house that's been flooded. Within there, the intangible bit, which includes impacts on people's mental health, is less than 10% of that 2,000. Now, the last study that was done looking at that, how you assess the cost of mental health, actually found that compared to the cost of damage to property, it outweighed the cost to society by 5 times. Now, if you applied that to the actual system, that would reverse everything we're doing. Everything we would do, we'd be spending 10% of the time on protecting properties and 90% of the time on reducing the intangible benefits. Now, obviously, you can't just turn a system upside down like that. That's like sort of revolutionizing the whole flood risk industry. But the data is there that we need to move away from just protecting property and focusing on building defences to, like you just talked about, increasing resilience in communities, which is how you reduce the intangible damages. That's what you've got to move to, and I think that is what we are trying to do on our projects and looking at groundwater flooding is look at resilience from a community holistic point of view, and not just focusing on how do we solve this problem.
We are in the middle of what is a climate change future. We are looking at different ways of doing flood management, different ways of adapting to live with climate change. Everything needs to change because this is not an option for us. And I guess my point, and I said I'm being a bit
bit in the left field,
well, not in the left field, but the point is, I guess, if we are looking to be truly transformative, part of that should include looking at the system and how we assess the value of investment, as opposed to what we're doing or we're in right now, which has worked. It's worked really well to date, but there's uncertainty about the future. And surely the first step is looking at that system and going, right, is that system flexible and dynamic enough to respond in the way we need it to going forward? Especially if there's emergent evidence elsewhere.
Yeah. And
challenging how we measure and value these different areas.
Yeah, and as well, that set damage per, person per property as it is at the minute in the multicolour manual. Does that need to change based on, say, social demographic or employment state? How do we do a deeper dive on that? It can't be the same for everyone and everywhere. And each individual flood type as well, obviously, depending on what that source of flooding is, it probably has a different impact on mental health. People that live with a river outside of you, they might be more accustomed to flooding because they've got that visual threat. It's still as equally as distressing and hard for people, but it's kind of, does each particular type of flooding cause different levels of anxiety or depression or PTSD, etc.
Yeah, and I think the other element is the flip side of it. So looking at how you measure the benefits of what you do. So at the moment, the system is really, really heavily weighted towards reducing flood risk to physical property. And that's how you score highly on the benefits side. But if you designed something, like you were talking about natural flood management earlier, so maybe you built a big wetland area that's open to the public, holds water, doesn't massively reduce the amount of flooding downstream, does to some degree, but not the same as building a load of walls and pumps, for example. But all the other benefits that come with that, the access to nature, you could talk about the well-being gains. Now, these aren't measured at the moment, and they aren't fairly weighted against things like just reducing flood risk by putting a wall in the way of it. Again, I think the system is recognizing this, and certainly I think everyone who works within the industry recognizes that problem. If you talked about it to them, they go, yeah, totally. The multiple benefits you get from doing something holistic, like building something with nature, just isn't fairly represented in the system at the moment, particularly around how you get funding for things. And it is changing, but I think we can help accelerate that change, is my view.
What about the homeless? What about people that have no fixed place of residence? Wherever they are, that's also their home. And it's just, when you look at it with a kind of inclusion lens, it just shows that when we are talking about this, we probably need to kind of go back to basics and review everything. It's easy to understand when people say my home is flooding, and we align with that because we also live in that similar space.
Yeah.
But what if there's someone out there whose home is not what we call or what we currently identify as a home? They also will be traumatized or displaced in an event of a flood.
Even when you think about home ownership against, say, social housing or shared accommodation, likelihood is, if there's a flooding incident, people will get displaced, but permanently.
They're more vulnerable as well.
Yeah.
When they do get displaced, they're likely to be from the more vulnerable groups as well.
Yeah. In
that situation. And lots to look in. I
know.
We're expecting all the answers from you, Jed. I know.
It obviously it weights on what we do. We've all got into this role in this sector to help people, to make the world a better place. And sometimes it's very hard trying to help people because you can't put that solution in straight away, and sometimes you can't put a solution in as well, and that's kind of, personally, I think that weighs heavy on me sometimes when you put in that situation. As fellow officers doing similar things, Jed, it's always good to talk and open up and have that discussion and know you're not alone on these things, you know.
Yeah. There are small measures, aren't there? But yeah, it's a big challenge. But there's lots of people that are up for the challenge, and there's lots of people that are working hard to change the narrative for many for the future.
Yeah.
There's lots of new skills and talent coming up through the work, should we say, through education.
So,
and I think it's a space where we need that diversity of thought as well. We need as many minds to help tackle this particular puzzle. But I think also it might sound a bit Debbie Downer at the moment, but just to remember that there's things that we can all do to help. There's information, there's support systems.
Yeah.
We've talked about property flood resilience.
Flood things.
There are ways to protect your home, or at least give you a level of buffer. If something like flooding were to occur, you have a better chance of recovering quicker as well.
Yeah, and Jed, just one kind of final question for myself here, and I was kind of working on that just earlier, was as officers dealing with the public, how do you feel we're trained to deal with people suffering with anxiety, or just in some cases anger, when we're going out and meeting people? How do you feel us as officers are trained, and do we need more specific training, do you think, as a whole, as a sector?
Yeah, it's a good question, Carl. I've been doing this for 20 plus years, and I've never been trained I've been trained in how to manage conflict in general terms, and that's helpful. That's basically how to deal with someone who's very angry, but how to deal with the wide range of emotions that come with flooding, I don't think we have. I think at the moment we do it on best endeavours, and we try to be empathetic. And earlier I think you said, as our jobs, we're trying to make the world a better place, which sounds a bit cheesy, but it's that is ultimately what you do when you work in the field that we do. Is you are trying to improve things for people, and you are trying to improve the world we live in. Would it be nice to have some specific training? Yeah, absolutely. If you happen to develop some or come across some, please do let me know, because I'm sure we'd all benefit from it down here.
Yeah, and also to kind of protect your own mental health.
I've took a lot of, and again, Jed, you might want to open on this too, but I've took a lot of what I've done, people I've engaged with very personally. It's kept us up at night. It's kind of, I've been put off my food. I've had to go and see counsellors, etc. And again, sitting there alone in your role is quite hard. Have you ever been through anything like that yourself? Or
yeah. I mean, I've worked in major floods, like probably 6-7 of them now, and spoke with people as they were being flooded, as it was coming in through the door, those kind of scenarios, and there was nothing I could do to help them. That feeling of helplessness, even though I'm essentially in a position of power and resource, but I'm powerless to help them. It's very difficult to deal with on a personal level, and that's your job. And you want to be out. You wish you could. There's something you could do, but
and again, you think you can't control the rain that comes down from the sky, and when it happens, what you're facing at work the next day, and you're thinking of these people as individual people because you've had a rapport with them, you've spoken to them over a period of months or years, and you always feel like you almost feel like you're letting them down. But in essence, I've had to come to terms with nature always wins, and there's only so much we can do. A lot of the problems we face, particularly in urban areas, they are engineered problems, and we're trying to engineer ourselves out of them against nature. And that's kind of where I am on this journey. So hopefully what I've learned can help you a little bit as well.
I think the other thing as well is we have such a skills gap. It does take an emotional toll. And I guess the risk there is, after a while, the people that we depend on to go out into communities to investigate these flooding events, to gather the evidence, to hold the hands of those in the communities going through the worst time in their lives, after a while, those people themselves just leave, and we haven't got the luxury of losing talent when we have a skills gap. So yeah, it's definitely worth something we want to find out more about. It'd be good, I think, because I'm like you, Jed. I got conflict management training, and it was around things like de-escalating or keeping someone neutral towards a positive outcome. And I think for most things you can, but is it realistic to go into someone's home who's having the worst time of their life and they're just expressing that? And yes, anger may be one form of that, but there's a whole range. Is it realistic that in that moment to expect that person to be reasonable as opposed to just react as a human being? On the other flip side, you have people trained to do their jobs, yes, but without the support, once they come away from the front line, how can you expect them to stay, even if they want to make a change and they want to, they want to be there? There is a part of you where it's almost like, I think for me, that's why when I see the NHS, I have so much compassion for them, because as far as I'm concerned, when you're that person in the front line, you are seeing
every day, everyone's going above and beyond.
Exactly. You're seeing a level of pain that most of us don't even think about. And so asking for that resilience, that support behind the scenes, it's just another way of just safeguarding those people, because we need them. I don't know how I ended up in the NHS, but it's but it's a fair point. So I think, and again, because we're on this FCRIP journey, we'll call it, is this something we should be talking to other FCRIP projects about? Obviously we've had a very it's impromptu, this as well. It's just came about as part of a conversation we've had here. We were sharing our experiences because we had Thunder Thursday.
2012
was the biggest one, but we've had several events since, and I went out to see a lot of the customers, but the narratives, the similarities in the stories we both share, and that can't just be two of us. And yes, when we talk about mental health, there is the kind of stuff we're now beginning to understand more, which is the community of people and that are affected.
And for me, I was most impacted mentally when it wasn't that first incident, but it was the incidents we had in 2015, 2016, where we had two incidents in very quick succession. But it was the people from 2012 where, they hadn't seen anything done in 4 years. Yes, there's a medium-term plan, but it's not on the ground. And I think that's when, you feel like you're letting them down. But as an individual, there's only so much you can do. And I think part of the impact is as well, because you've got the badge of an organisation on your ID card or your high vis or something, they need a release, they need to let out, they need to tell someone exactly how they feel. And I think sometimes if they're doing it towards the organisation as opposed to an individual, it's not necessarily personal, but I think it gets to a point where we probably do start taking it personal.
That's where the behind the scenes support, the mental support, mental health support, whatever.
Yeah.
Just expanding the kind of training we provide for those type of key staff. Because then you have burnout and then people leave and kind of in a vicious circle that we're not actually going anywhere. And we need to retain the skills as well.
Absolutely.
Anyways.
Yeah.
On that note, Jed, thank you. Thank you so much. We look forward to hearing more and find out what comes out of your mental health study, which is part of the project you're running. And yes, if there's a bit in there about support for those who are also on the front line, that would be great, because I think we both feel that that's something that we'd really like to explore as well. And FCRIP has created a platform for it, so why not? It was good to see you.
You too. Thank you.
Thanks for listening to the PGN podcast today. We hope you found it informative and enjoyable. If you did, please like and subscribe to the podcast. But also, please, if you find this useful to anyone else, pass it on and spread the word.
To find out more about Project Groundwater Northumbria, please visit www.pgn.org.uk.